Hi, this is Lori Hacker, and I will be speaking to you about reducing obesity through lifestyle management. Obesity is a growing problem in the United States and linked to many health issues. Healthy People 2030 initiatives are focusing on helping consumers get healthy by reaching and maintaining a healthy body weight. We know that about 2 in 5 adults and 1 in 5 children and adolescents in the United States are obese, according to Healthy People 2030. And Healthy People initiatives have several objectives put forth to reduce the proportion of children and teens with obesity and reduce the consumption of added sugars by people over age 2. The presentation today will focus on the objective of reducing the proportion of adults with obesity. The baseline data reveal that 38.6% of adults over the age of 20 were obese in 2016, and the target is to reduce this to 36% by 2030. Obesity is linked to many chronic diseases, as we know, such as diabetes, cardiovascular disease, and cancer. And additionally, obesity creates stigma and contributes to discrimination. We know that intense behavioral interventions that use more than one strategy, taking multiple approaches, can be effective ways to reduce obesity. Multiple strategies include things like group sessions and exercise and dietary changes and support. We also know that cultural influences play a significant role in influencing obesity. The cultural norms that are passed down generation to generation are more significant than urban or rural environments that influence obesity. We might be surprised to hear that that is often a stronger correlation based on cultural and familial influences versus where someone actually lives. A systematic review between 1989 and 2009 examined obesity patterns among women living in the Appalachian region. Common themes from this literature review emerged, which include lack of regular exercise, high rates of obesity, poverty, and low educational completion. Franciscan Health in Mooresville, Indiana, has a survey, Community Benefits Inventory Survey, where they gather data from multiple data points, including American Community Survey and the Centers for Disease Control and Prevention. This study from Franciscan Health found that 10.5% of residents of Morgan County, Indiana, live in poverty, with the poverty rate higher among children under the age of 18, which is 15.5%. 12% of the population have not finished high school, and the food insecurity rate among children was 18.1% in 2016. Half of the Morgan County children are eligible to receive free and reduced lunch. From all of this, we understand then that the CDC reports that 34.2% of Morgan County residents were obese, with higher rates of diabetes compared to the state average. Cancer rates and cardiovascular disease are also higher in Morgan County than the Indiana state average. So some of the parameters that we'll be looking at this project is how functional and lifestyle medicine can play a role in this area. Functional medicine is a growing field that focuses on lifestyle and root cause of disease. It's central in the prevention and reversal of many chronic diseases. It uses a biology-based identification of root cause, which includes things like genetic expression, environment, and lifestyle. For example, targeting mitochondrial function with a personalized lifestyle intervention led to significant improvements in energy, strength, bone density, and quality of life. We also find that through lifestyle management, patients can lose weight. Some of the benefits of lifestyle management include not only nutrition and exercise, but also looking at sleep, stress management, and how patients balance their hormones as a comprehensive and whole person approach to obesity. 10% of weight loss can result in a person saving up to $5,300 in their lifetime on medical costs. There's also a whole range of financial benefits in weight loss, including wealth building, lower health insurance premium costs, and higher wages due to stigma related to appearance. So one specific initiative that a nurse leader may implement is offering a program called the Daniel Plan to faith communities among Morgan County. The DMP nursing leadership approach would include two pieces: identification of faith communities in Morgan County that might be willing to participate in a lifestyle modification program, and then the goal would be to engage these faith communities in a whole person lifestyle modification program, which would look at not only nutrition, exercise, healthy sleep, hormone balance, and really eliminating the root cause of many chronic diseases through lifestyle management. The evidence for this program include, we know that intensive behavioral modification interventions are effective. That comes from Healthy People 2030. We also see that cultural influences such as faith communities play a role in handing down traditions and supporting people in either healthy or unhealthy lifestyle and behaviors. We also found that Franciscan Health Hospital System have identified Morgan County, Indiana as a vulnerable population due to not only its limited access to healthcare services, being a rural population where many have to drive upwards of an hour to get to a local hospital system, and also the high rates of obesity and cardiovascular disease compared to the state average. The CDC reports that 34.2% of these residents were obese, which is higher than average. And we can see that lifestyle and functional medicine can create personalized interventions. As mentioned before, we can use the concepts of mitochondrial targeted programs through adequate sleep, nutrition, stress reduction, hormone balance, that will lead to significant improvements in energy and quality of life. Overall, this program then can prevent and reverse chronic disease, and we know that diabetes, for example, is primarily preventable. So the practice initiative for this project would be that the nurse leader may implement a program called the Daniel Plan to faith communities among Morgan County. It would be offered through a train the trainer approach. Through the integration of faith and health, this 40-day program has its foundation in lifestyle medicine and provides a multifaceted approach to these communities that can help combat obesity. The plan includes things like small group meetings over a 40-day period for support, audio-visual elements such as DVDs to introduce lifestyle concepts such as whole food, plant-based nutrition, also concepts of exercise, balancing stress, adequate sleep. It also incorporates the faith component and the integration through prayer and community support through the small group meetings. The Daniel Plan also has a variety of technological supports through apps that they can put on their phone, as well as textbooks and other workbooks and resources so that communities can actually engage with the information. And this all results in this behavior modification through this evidence-based training in a motivational theory that's an integral part of the plan. So the budget for this program, when we think of it as a train the trainer model, would include, after the identification of a goal of 10 area churches for the pilot, would ask for one key stakeholder or health leader at each church to participate, and those initial costs would be approximately $500. Those costs would include things from the Daniel Plan, including a campaign kit, which includes sermons and bulletins and resources for those health leaders in the churches to grow some momentum and some enthusiasm for participation. The study guide itself is about just under $9 per person, and the DVD would cost about $15 per church. So overall cost about $500. Franciscan Health Hospital System has a community benefit grant that's available, and especially since this Morgan County area has been identified and targeted by that system, the community benefit grant would likely be the resource to pay for this initial train the trainer model. The overall impact of this program would include empowering area churches to facilitate the Daniel Plan that would help members walk through lifestyle changes in the community, one person at a time. It also would create champions within those churches then to continue to hold the Daniel Plan courses and programs over 40 days, whether it's once or twice a year, to get the rest of the congregation or membership engaged in lifestyle modification. It includes elements that would help church leaders and elders who definitely hold sway and authority and leadership over these communities, and then could lead their congregations in principles that are biblical and integrated through faith and health. The creative champions, again, within the faith communities would help lead the change. For example, that might alter what is served for potluck dinners. So instead of a carb-heavy, low nutrient-dense options that would be brought in, perhaps healthier options would be considered. Or what kinds of snacks would be provided for the Sunday school program for the nursery or the preschool age groups might be leaning towards the healthier options that would be fruits and vegetables. They may consider engaging in active faith-like prayerful walking programs, such as programs like the Walk to Jerusalem or the Walk to Bethlehem, that would get the whole church walking together in an integrative whole person way. Faith communities often lead the way among cultures for positive change, especially communities with health disparities. So this impact would be very unique and specific, as some members of faith communities don't engage in traditional healthcare initiatives. Methods evaluation for this program, for a start, for a Train the Trainer, would be a measure of the total number of participants from beginning with the Train the Trainer model and the 10 identified stakeholders to, during the evaluation period, how many actual individual members participated in the Daniel Plan 40-day lifestyle program. Comparisons could be made about body mass index for faith communities participating to see if we're looking at decreases in overall body mass index. And then certainly we could measure something such as total number of minutes exercised compared to prior to the Daniel Plan initiated and after, to see if we've made some measurable improvements over the course of the 40 days. So as you can see, the DNP leader can use a model such as the Daniel Plan to incorporate lifestyle and functional medicine practices within the community setting by targeting those groups that are at highest risk for health disparities. The Daniel Plan lifestyle allows a lot of participants to get off medications, minimize chronic illnesses, lose weight, and all of that strives towards matching the goals of Healthy People 2030. You can see the brief list of references here, and I appreciate your time. Thank you.